Hey, it's Edward McEachern. I'm the Chief Medical Officer at PacificSource Health Plans, and today we're with.
Hi, my name is Tiffany Jones. I'm a senior clinical pharmacist with PacificSource Health Plans.
And today we're going to talk about biosimilars. So, Tiffany, tell me what a biosimilar is.
So, a biosimilar is a complex drug that is really similar to a branded product. And so it's just slightly more complicated than, let's say, a pressed tablet. It tends to be an injectable, but it is very clinically similar with no meaningful differences.
A lot of people are familiar with brand versus generic. So, why is this different from that?
So the difference is the complexity that goes into making the product. If it's a little bit more complex and it's a lot more multi-step, then it's more likely to get that designation of biosimilar versus generic. And so that's why it tends to be things like insulins and synthetic proteins that get biosimilar designation as opposed to generic.
Okay. And so, do biosimilars have the same name as the original drug?
That's a complicated question, but they actually do not. So generics, when they come to market, take the chemical name of the product. The biosimilars actually get their own individual, somewhat branded name. So for example, like Crestor, when the generics came to market, they became rosuvastatin, no matter who made the product. But for things like insulin, like Humalog insulin, it became Admelog, and it also became Insulin Lispro, and it can become other branded names that are not the same. So you can have multiple different names for biosimilars.
So different names, mostly related to the more complex process it takes to build these drugs or these class of drugs. How do I know that they're the same as the original?
So just like the original branded product, the FDA, the Food and Drug Administration, actually undergoes rigorous testing, and it starts at the molecular level. They have to prove that it is the same thing and similar enough at the molecular level that you would not expect there to be clinical differences before they progress to human trials. And then they go through human trials to prove that there's no clinical difference in the outcomes of the patients who use the drugs.
How long have we been using the biosimilars, and how do we know that they've been proven to be safe?
So they've actually been around for quite a while. It was more about a regulatory pathway to kind of create that similarity profile. So the first biosimilar in the US was actually approved by the Food and Drug Administration in 2015. And it was actually an add-on chemotherapy agent that we frequently use, but it's been around significantly longer in other developed countries. So the European Medicines Association, the EMA, actually approved their first biosimilar in 2006.
Wow. Okay. So they've been around, they're tried and true kind of things. So does anybody else besides the FDA approve or recommend use of these things?
Yes, actually. So virtually all medical societies and individual guidelines have actually signed on for the use and support the use of biosimilars. So that includes the National Association of Cancer Networks, that includes the Association of Physicians, and individual guidelines. And that's because the practitioners within these fields have used biosimilars and that they've seen that there's no differences in outcomes among their patients, and they support more products being available.
Nice. That's great. Well, what kinds of products are going to get biosimilars?
So currently, I was like, it's going to be any complex type of molecules, and typically they tend to be injections, but currently we have them for things like insulins. We have multiple types of them for insulins, but we have them for things like Remicade, which was one of our first monoclonal antibodies. It's used to treat autoimmune conditions like rheumatoid arthritis and irritable bowel conditions. And it's also, we're planning on getting them for Humira. The FDA has approved multiples, and so that's going to be game changing because it's going to actually increase the number of products on the market for everybody.
Wow, that's pretty cool. So we've talked about biosimilars a lot, and sort of they're in some ways very similar to generics and name branded drugs. Can you tell me the benefits of biosimilars?
Yes. So the benefit is really that the more products there are on the market, the less impacted we would be by shortages or issues with one particular manufacturing plant, which we saw can happen during COVID times. And that leaves a lot of our patients vulnerable, but also more products on the market and more competition actually has the effect of lowering prices across the board for everybody. And by lowering prices, you make it more available for everyone.
Let's say I go to my doctor and he or she gives me a prescription for a named drug. Can I go to the pharmacy and get the biosimilar there?
So that's a good question. So not all products that are biosimilar have what the FDA calls interchangeability. So in order for a drug to be deemed interchangeable, they have to prove you can switch back and forth multiple times without differences in outcomes. So many of the products that have been deemed clinically not meaningful differences haven't undergone those studies to gain that interchangeability designation. So you may actually still need a prescription to switch from one product to another. So I actually recommend if you wanted to change product or it was necessitated by your plan that you change product, that you actually speak with your provider.
So yeah, that makes sense. The provider probably ought to have a conversation with me about this biosimilar and why it's cheaper and why it's better for everybody. If the clinical outcome's not any different, I don't know why you'd prefer a more expensive drug. What if my health plan is requiring me to try a biosimilar first? What's the conversation I ought to have there with my pharmacist and the doc?
If you have any hesitations about the product, I would definitely encourage you to speak with your provider because it's not necessarily that your health plan would always require you to switch. Health plans are doing, what they've always done, which is they're going to usually require or let you know which product is going to be the lowest cost to you and to the plan overall, so that those savings can be passed on in the form of lower premiums. And so by lowering the cost of all the products, when biosimilars come to market, oftentimes the brand can sometimes be cheaper as well.
Yeah.
So it's not necessarily that you would always have to switch, but your health plan would notify you if you needed to.
Yeah, I mean, one of the things we do see with biosimilars is when they come to marketplace, the original named drug usually drops to a price that's very, very competitive with the biosimilar. Tiffany, thank you for the conversation today. What have we not talked about that you think might be helpful for our listeners to hear from you?
I think what would really be helpful is if you're feeling any type of hesitance in switching products or you're not really sure, I would definitely speak to your provider. Biosimilars are not necessarily new, and many of the products that are getting approved here and are just now launching here have actually been available for almost a decade all across the world. So we do have lots of studies and lots of great information that I'm sure your providers would love to share with you, and that can ease your fears about things and talk to you really on a one-on-one level and address any concerns you might have.
The pharmaceutical world is kind of complex and fast moving. For our PacificSource listeners, we do have pharmacists on call that can answer during normal business hours questions about this. And there are people like Tiffany. You may even talk to Tiffany. It's a wonderful service that we offer. Again, Edward McEachern, Chief Medical Officer with one of our star pharmacists, Tiffany Jones here. Thanks for tuning in today.
Thanks.